Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide brief remarks, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I begin my update today, I would like to correct an error I made on Monday when answering a question about asymptomatic testing. In my answer, I said that our testing of those who have no symptoms and no known COVID exposure has yielded, on average, only 7 positive results per 1,000 people tested. The actual number is about 7 positive tests per 10,000 people tested, which again emphasizes the fact that this testing is not contributing significantly to the new cases that we are seeing. I apologize for any confusion this caused. I would also like to recognize that today is World Patient Safety Day. Patient safety is crucial to any health system, and I know that improving safety has been a priority in Alberta for years. This year's theme focuses on health worker safety, and it is a fitting one. Every day, health workers commit to keeping those in their care safe from harm. For them, this pandemic has brought new challenges, including illness, stigma, fatigue, and even the risk of severe outcomes. They have worked long hours and incredibly hard in stressful environments for months now, often while putting their own health and well-being at risk. The success we have had in limiting spread and the low number of cases seen in acute care and other settings is a testament to their commitment to patient safety. I want to take a moment to thank all the healthcare workers in Alberta for their dedication to patients and to safe, quality care. We are grateful for all the work you do and for the way that you do it. Turning to today's update, we identified 146 new cases of COVID-19 yesterday, and the provincial lab completed more than 13,000 tests. Currently, Alberta has 1,483 active cases. 41 people are currently in hospital, including 8 in intensive care. There have been no additional deaths since our last update. This pandemic has forced us to talk a lot about case numbers and data trends, but I want to remind us all that every person who contracts COVID-19 needs our support and compassion during a difficult time, and each of these numbers represents a person. This is particularly true of those behind our school numbers. As of this morning, AHS has confirmed 64 cases that were present at 48 schools while infectious. While the people behind these numbers are at a low risk of severe disease, they are finding themselves collectively subject to intense scrutiny. Please remember that these are individuals, and they are not bad people. They and others at their schools need support to navigate this time of transition that can sometimes be made worse by false assumptions about risk in these schools. Since yesterday, we have confirmed 1 new school outbreak at the Chris Ackerman School in Calgary, bringing the total number of outbreaks to 10. A reminder that we are using the term outbreak very cautiously. 2 cases are a sign that we are taking action and watching closely, but not a sign that the school is unsafe. So far, there is no evidence of transmission within schools. However, as I mentioned on Monday, we do expect that this will happen eventually. That is why we are being extra cautious in declaring outbreaks, and AHS is working closely with school authorities to ensure all close contacts are quickly isolated to limit any spread of COVID-19. Today, I also want to update you on a change we are making to improve Alberta's testing approach this winter. From a public health perspective, we are facing a significant challenge over the coming months. COVID-19 is still here and is not going anywhere. At the same time, influenza season will soon begin. This means that in addition to potentially contracting COVID-19, Albertans will have a greater chance of catching a cold or flu, which have very similar symptoms to COVID-19. More people with symptoms means that we will see more people needing to be tested. Our lab system needs to support cases of both COVID-19 and influenza. Winter also means that we will be spending more time indoors, and COVID-19 is a virus that spreads easily through close contact, especially indoors. More time indoors increases the risks of exposure, which also increases the need for us to increase access to quick and timely testing. What's more, COVID-19 testing will remain crucial to supporting a safe school year and keeping Alberta's economy open throughout the winter. The result is that we and every other province in Canada must prepare for a surging demand for tests this winter. We must prioritize our testing, especially as we prepare for the flu season, to ensure that testing is scheduled and results are returned as quickly as possible. I am tremendously proud of our lab system and the remarkable health professionals who work in it. On May 29th, Alberta became the first province in Canada to offer widespread voluntary asymptomatic testing to any Albertan. As you may recall, when we expanded this testing, I was clear that this broad eligibility was to enable population surveillance to understand more about COVID trends in the general Alberta population, not for individual case finding. I want to thank everyone who participated in the asymptomatic testing program in the recent months. This testing has given us a far better understanding of how COVID-19 is and isn't spread. We have conducted more than 233,000 voluntary asymptomatic tests since May 29th. This is a tremendous number. These are tests on people without symptoms and without known COVID exposure. Of these 233,000 tests, only about 7 per 10,000 tests have come back positive. This means that it is very rare to find cases in those without symptoms and without known exposure. And this testing is not driving the new cases that we are seeing. The asymptomatic testing program has also helped our labs prepare for the high volumes of testing we will need in the months ahead. We processed a large volume of tests this summer, which has helped stress test our system and identify places where we need to improve. Now we are acting on these lessons learned. Today I am announcing a shift to a more targeted approach to COVID testing in Alberta. We will continue testing any Albertan with symptoms, while targeting asymptomatic testing for those who most need it and where it is most likely to identify positive cases. This is the best way to limit the spread of COVID-19 and protect the health of Albertans during the winter and flu season. Let me be clear. Anyone with symptoms, anyone who is a close contact of a confirmed case, and anyone who is linked to an outbreak will continue to be tested. These are and always will be our top priorities and are the highest value clinical tests. In addition, asymptomatic testing for those with no known exposure will continue to be offered for priority groups that are most at risk of spreading COVID-19 to vulnerable or at-risk populations. This includes residents and staff in congregate settings, healthcare workers, school teachers and staff, and Albertans experiencing homelessness. Asymptomatic testing is no longer recommended for other Albertans who have no symptoms and no known exposure to COVID-19. Any Albertan who has no symptoms but has already booked a test will still be able to get tested. We also know that for some who are traveling internationally, there are requirements for a negative test. This group of people will also still be able to access testing going forward. This change to focus on priority groups will help ensure testing is scheduled as quickly as possible and shorten the length of time that Albertans are waiting to get results. In the past, I've said that we must be nimble and keep adapting our approach based on what we learn. This shift is an example of that. We have conducted more than 233,000 asymptomatic tests and are acting on what we've learned. I know that this has been a long pandemic, but we have learned much, and today's change is part of how we are continually updating our approach to incorporate what we learn. We have clear evidence that shows where testing is most effective, and a lab system with significant capacity to identify cases and protect Albertans. We will continue to monitor the testing approach and make any additional changes that might be needed in the future. Our system is strong and getting stronger. We are all in this together, and we will get through this together. Thank you, and I'm happy to take any questions.
All right, we'll go to the phone now. In addition to Dr. Hinshaw, we also have Andre Corbold, Deputy Minister with Alberta Education, who's also available to answer questions. Operator, could you put through the first caller, please?
First question is from Jason Herring, Postpedia. Please go ahead.
Good afternoon, Dr. Hinshaw. This morning, Ontario announced they were reintroducing restrictions on gatherings in some regions due to a recent surge in cases there. This is despite the fact that Ontario has generally had a lower positive test rate than Alberta. Given this, I'm wondering if you are considering recommending restrictions to gatherings to be similarly reintroduced in Alberta.
Ontario, as you say, has made decisions that are appropriate to their context and the trends that they are seeing there. In Alberta, as I've said before, we are looking very closely to see if there are trends where we're identifying significant transmission issues. And we will obviously have discussions if we identify one single activity that seems to be where most of these issues are happening. As I've said before, often we see transmission happening within social settings, such as people gathering in their own homes. And it's very challenging to be able to put formal restrictions in place that would limit that activity. What we need to make sure we do collectively, all of us, is both ourselves and encouraging others to be thinking about the responsibility that we have to protect those around us and not to leave that to others to tell us what to do. So I think, we've done our best to make sure that the guidance is very clear and that the ways that Albertans can protect those around them is laid out. And so what we're doing, of course, is, again, watching our data, but also really encouraging Albertans to continue making decisions to protect themselves and, critically, the health of those around them.
Operator, could you put through the next question, please?
Next question is from James Keller, Globe and Mail. Please go ahead.
Could you explain sort of how the pharmacy testing program will fit into this change? Will they be also sort of operating under the same rules as far as, not broad asymptomatic testing, but only these limited groups?
Yes, that's correct. So pharmacy testing will still be available and accessible to the groups that I mentioned with respect to anyone who works in a continuing or congregate care setting, residents of those settings, teachers or school staff, and healthcare workers. So they would be able to access that testing through the pharmacy if they wished. But as I mentioned, others who don't fit into those categories, we would not be recommending testing for those people at this time. Again, the eligibility is really focused on those high priority and, of course, those who are symptomatic or close contacts who would need to go through the AHS assessment centres.
Operator, can you put through the next question, please?
Next question is from Rafi Bouchikanian, CBC. Please go ahead.
Hi, thank you. Dr. Hinshaw, I guess I just wanted some clarification on what you mean when you say that you've conducted so many tests of asymptomatic people and have determined that this is now the new shift you want to go through. So are you saying that a majority of asymptomatic tests of people who weren't part of priority groups or who were not exposed to contact turned up negative? Is that why this shift is taking place?
Yes, that's correct. So again, when we opened up our testing to any Albertan, whether or not they had symptoms, when I spoke about that when we first launched it, I was always clear that our highest value clinical testing is always those who have symptoms, close contacts, or outbreaks, and that's always been our number one focus. When we were moving through our relaunch phases in May and June, to expand our ability to monitor the potential for spread in the population that we might not be detecting with our high priority testing, we did expand at that time to be able to do that monitoring and allow Albertans to have access to that to help us understand what was happening within the population. But we've really seen, again, that if an Albertan has no symptoms at all, they have no known exposure, they're not part of an outbreak, we have had a very small number of positives that we've identified through that, but the vast, vast majority of people who were tested in that category have tested negative. And again, the purpose of that testing was to help us monitor that population over time. We've done that. We've confirmed that, again, there's an extremely low yield for that kind of testing. And so we really are moving again back, anticipating that as we move into the next few months, there will be many more people who have symptoms, who need to be tested rapidly, and we need to shift back towards that high clinical value with those priority groups, as I mentioned, still being able to access testing to make sure that we're preserving that particular piece of the system. But again, our highest priority always is and always has been those where they have symptoms, close contact, or outbreaks.
Operator, could you put through the next question, please?
Next question is from Helen Pike, CBC Calgary. Please go ahead.
Hi, Dr. Hinshaw. Thanks so much for taking my question. A lot of Albertans and parents online are talking about whether or not Halloween is canceled or how to even do it this year. Can you give an update on where the province is at on that?
Absolutely. Recognizing that Halloween is a holiday that many people enjoy and look forward to. Halloween is certainly not canceled. It will look different this year. We don't have final guidance available, but we are working on it. And ultimately, as with any activity that we do during COVID times, we need to think about how to do it safely, how to make sure that the activities don't put people at risk of either getting COVID or potentially spreading it to others. And those are the kinds of things we're working through in the guidance. So we are working on it, and we will have that released in the coming weeks.
Operator, can you put through the next question, please?
Next question is from Sean Fournette, CTV. Please go ahead.
Hello, Dr. Hinshaw. With the new restrictions on testing, just to be clear, are people going to be starting to have their test requests refused? For example, I know of a lot of people who have gone for tests before they're about to visit an elderly relative, for example, or if they're about to make a trip into Saskatchewan or BC, just to be safe. Are those people now going to be told no? Because seems to be quite a change in messaging from before when you were urging all Albertans to go and be tested.
Yes, and again, we really wanted all Albertans to take advantage of that, particularly to help us understand what was happening in the population. And I want to be really clear that I'm very grateful for all Albertans who took advantage of that, who helped us out by going to be tested and helping to be a part of that population-based look at how is COVID spreading. And I honestly, again, I think what we've learned from the very large amount of testing we have done with the extremely low yield in positive results is that if an Albertan is thinking about, for example, traveling to Saskatchewan, visiting a loved one, if they did go to get tested and it took even a couple of days for them to get that result back, remember that testing is just a snapshot in time. It tells you at that moment in time whether or not there was virus that could be picked up on that test. It doesn't tell you if the day after, 2 days later, or a week later, you may have COVID at that point in time. So again, really want to acknowledge the Albertans who took their time and came and helped us out with the population surveillance. But we need to now learn from that and say that if you don't have an exposure to COVID and you don't have any symptoms, you're not part of an outbreak, that it's the other measures that you need to follow, such as if you're visiting a loved one in continuing care, wearing a mask, making sure that you're distanced for the bulk of the visit, if possible, kind of doing all those other things are what's going to keep your loved one safe. And that test, again, what we're seeing is that test really perhaps was an added layer of people feeling safe, but it's not an accurate predictor. It simply has a way of helping us understand at that population level what was going on.
Operator, can you put through the next caller, please?
The next caller is Julia Wong, Global News. Please go ahead.
Hi, Dr. Hinshaw. The Canadian Pediatric Society says keeping children in school is critical for mental health. The Society says that tighter restrictions are needed to curb community spread. It believes wherever there is community spread, like bars and restaurants, social gatherings, those should be shut down first before schools are. It says schools should only be closed as a last resort. Is that something you agree with and can commit to? And if not, why not? Also, another question, a Mackenzie County councillor shared a Facebook post that called for people to not get tested for COVID-19 because it gives the government powers to lock down again. The Post also says just stop the testing and this will disappear overnight. What's your reaction to this information being shared and being shared by an elected official?
With respect to the first question, the importance of in-person schooling is absolutely critical, and that was a part of our planning in terms of looking at our options for providing the ability for students to return to school in as close to normal setting as possible, knowing that with COVID we do need to have additional restrictions. When we look at how we manage the control of COVID-19 in a community, it's really important that we're thinking about the overall health of that community. And so with respect to, closing a restaurant first before a school, ultimately, I think, first of all, whenever there is a specific situation with an exposure, if there's an outbreak, or if there's a reason that a particular single location may need to have additional measures taken, that's really based on that individual context. And so that's something that we always do, no matter the setting, whether it's a school, whether it's a business, whether it's a community activity. If there is a significant amount of spread happening at that one particular location, then that location would need the appropriate measures directed at it. At a population level, in terms of additive restrictions, we need to think about the overall impact of whatever it is that we're doing. So absolutely, students benefit from being in school in person, but they also need to have be part of a family that has adequate income. And so thinking about the impacts on other sectors of our society when we impose restrictions or shut things down is an important part of that overall consideration when we're thinking about how to limit community spread. And ultimately, my message to Albertans is that we don't need formal restrictions to limit community spread. We all have the power to make sure that everything that we do contributes to lower COVID transmission, and we don't require restrictions to do that. That's something, again, that we can all contribute to. The second question with respect to the Post, I haven't seen it myself. My response to anyone who indicates that a choice to not be tested will help the virus disappear would be to say that unfortunately the virus persists whether or not we test for it, and when we don't know where the virus is, it gives it the opportunity to spread rapidly and broadly. And that's when, unfortunately, we do see consequences of the virus getting into populations that are most vulnerable to severe outcomes. And the testing is a tool that enables us to best understand where the virus is spreading and to help those who are part of that community to know what they can do to protect themselves and their loved ones. And so I would really, again, encourage anyone who's feeling ill or who's a close contact to participate in the testing program and work with public health. Our aim is to support communities to have that overall health, both minimizing impacts of COVID, as well as minimizing any impacts that restrictions may have, because we are in this for many months to come, and we need to achieve that balance.
Operator, can you put through the next question, please?
The next question is from Eva Ferguson, Calgary Herald. Please go ahead.
Yes, thank you very much, Dr. Hinshaw. I had a question about quarantine protocols in school, and specifically why there seems to have been a change to the definition of a close contact and what would require self-isolation of students and staff. So we know that back in late August, you had said that in schools, anyone who had been within 2 meters of a case for more than 15 minutes without adequate protection would be considered a close contact and would have to self-isolate for 14 days. But this week, on Monday specifically, you said if a student comes to school while infectious with COVID, the approach is to require all of that student's classmates to stay home for 14 days. So we know that many students are in assigned seating in classrooms now, and many students would be well over 2 meters away from a positive case. So my question is, why would these students still have to quarantine and face a significant disruption to their learning as a result?
One of the things that we've seen in terms of a practical response as we've been working with local public health to respond to cases that have been infectious while in school is that especially when students are perhaps with multiple different groups in a day, as may be the case with older students who are in different classes. But even with respect to students in younger grades where they may have assigned seating, but they are also out of those seats when they're perhaps out at recess or moving around at different times. And the decision was made to move towards a more conservative approach, again, for the first several weeks of our response, because what this will allow us to do, while we do have that definition of more than 15 minutes within 2 meters, what this allows us to do is to test our ability to define that when you look at not just where they're sitting in the classroom, but how other students are interacting perhaps on the playground or in other places in the school. We'll be able to evaluate with our own data how we can best identify those risks, and if it really does seem to be about where people are sitting, or if there is something that's relatively easy to target, then we will absolutely refocus back down to a smaller number of students going forward. But given our commitment to make schools as safe as possible, we wanted to make sure that we were starting out with that broader approach to be able to do that evaluation, to then be able to ease off going forward, rather than a concern that if we focused only on the classroom and we weren't looking at other places where students might be interacting, that we could potentially miss some exposures and potentially contribute to transmission within the school environment. So I know that it is frustrating. I know that it is challenging for parents to have their children home for 14 days. And as I say, we are doing this only now so we can make sure that our assessments going forward are based on the best available data within our school environments, within our school return model.
All right, we've got time for 3 more questions. Operator, could you put through the next one, please?
Next question is from Heather Urick, Global News. Please go ahead.
Dr. Hinshaw, thanks for taking my question. My question was about the opioid crisis. I understand that the overdose numbers for April through June are now available and will be published shortly. I'm wondering if you've seen these numbers and if you have any concerns. Also, your thoughts on BC's move yesterday to expand access to safe drug supply, and if you think that's needed in Alberta. Thank you.
So the report is being prepared, and I understand will be released in the coming week. And so at that time, once it's available, then we'll be able to speak to the trends I think we've seen across the country, certainly with the numbers in BC, that just like COVID-19 has had an impact on every other aspect of our society, it has also had an impact on individuals who may be using substances that could be contaminated with fentanyl. And so that's something, again, that once those numbers are available, that will be something we'll be able to speak more about. With respect to the question about BC's policy and moving to different kinds of drug supply, policy issues and policy changes would be, questions about that would be best directed to the Associate Minister's Office for Mental Health and Addictions.
Operator, can you put through the next caller, please?
Next question is from Alex McQuaig, CHAT Medicine Hat. Please go ahead.
Thank you. This is a question for Dr. Hinshaw. You touched on this a little bit regarding the overall impact and the adequate income supports. Here in Medicine Hat, we're hearing a lot about parents struggling with having used up their sick days, having used up their vacation days, not having necessarily the financial supports. And a number of parents are home with aren't at work, they're home with their kids. Can you talk about what supports are available for these parents in this community that historically has one of the highest percentage of minimum wage earners in the province?
It's a really critical question, and we've certainly seen not just those who are staying home because they're parents and they may need to care for a child who's either sick or perhaps has been exposed to someone at school and is in quarantine, but also those who are themselves feeling perhaps mildly ill and knowing that there may be a difference between do they go to work while mildly ill and end up earning money so they can pay their bills, or do they stay home with no income especially if they're feeling only very mild symptoms. And that is something that I have raised nationally with respect to the income support programs that are available, and I'm talking to my colleagues about how we can collectively bring forward the concern about the fact that unless we're able to support individuals who need to stay home, either when they themselves are ill or if a child is ill, unless we can do that successfully, we will not be able to prevent COVID-19 from spreading. With respect to specific programs, that's something that we'll have to direct to, I think, another ministry or perhaps to available resources online with the federal government. But it is absolutely a concern that I have, and again, something that my colleagues and I have been discussing.
Alex, we can ask the appropriate branch of the government to get back in touch with you. Operator, could you put through our final question, please?
The final question is from Brittany Gervais, St. Albert Gazette. Please go ahead.
Hi, Dr. Hinshaw. Thank you for taking my question. We've heard some details around the province's plan to handle the influenza season. We've heard that they've ordered more doses of the vaccine and some details on administration. I'm just wondering if you could provide any more information on the province's plan to handle this upcoming flu season, especially if we see a surge in cases and additional stress on our healthcare system.
Yes, an important question, and we are working in multiple ways to prepare. So as you mentioned, we have ordered extra vaccines so that if we, like other countries, see an additional demand for vaccine, there will be enough available for all those who wish to receive it. And we also have worked with the federal government to access a high-dose influenza vaccine that will be available for those in continuing care. We also are working to make sure, as I mentioned, that our lab testing capacity is ready and able to respond to increased demand for symptomatic tests. And of course, as we're looking ahead at the coming months and thinking about both the ability to respond to COVID-19 as well as influenza, making sure that those pieces are taken into account as we plan for any need for surge capacity within acute care or ICUs. So again, it goes from prevention all the way to response to those who are most severely ill, and those pieces all kind of come together in planning for the season, as well as making plans for the delivery of influenza vaccine to happen in ways that don't put people at risk of being in crowded indoor places. So we are taking into account those COVID-19 precautions as we plan through our influenza immunization program. And I expect that more details will be available in the coming weeks with respect to the influenza immunization program and our planning.
Thank you all for joining us. Dr. Hinshaw will provide another update on Monday afternoon. Have a good day.